Post-operative instructions. Precautions after rhinoplasty. In general, you can return to your daily activities after 2 to 3 days. You can take a shower on the second day provided that the nose cast and tapes remain dry. For this purpose, we recommend that you wash only your body and do not run water over your nose. From the second week, you can perform light exercises, including walking. We recommend that you begin heavy exercises 4 to 6 weeks after the operation. Swimming is allowed after 2 weeks, but jumping into the sea or swimming pool should be avoided. To prevent edema, avoid sauna, Turkish bath, solarium, sunbath, steam bath, and swimming in the sea and pool for 6 weeks. To prevent sunburn, avoid the sun or wear a hat for 6 weeks. Additionally, apply a factor 50 sunscreen on your face. For oral hygiene, use a mouthwash from the first day after the operation. From the second day, you can brush your teeth using a soft toothbrush. The procedure for local cleaning of the surgical wound will be explained by the surgical nurses on the day of discharge. You will need to clean the area at your hotel 4 times a day for 3 weeks after the operation. We will provide you with antibiotic-containing spray, oxygen water, hydrogen peroxide solution, and cream. The surgical nurse will explain how to use them to you in detail. Sleep with your head resting on a high pillow, face up, for the first 48 hours to reduce the swelling. Avoid sleeping with your face down for 6 months to protect against pillow trauma. Place ice packs over the eyes for the first 48 hours after the operation to reduce the swelling. Drinking more water will also reduce the swelling. Avoid consumption of green and herbal teas. Black tea and coffee are allowed. If needed, sneeze with your mouth open for 6 weeks after the operation. Avoid lifting heavy objects for 2 weeks. Driving is not recommended for 2 days after the operation. Post-operative massage is most effective for 6 months after the operation. Massaging your bone, cartilage, and soft tissue in front of the mirror for 2 minutes a day will be sufficient to reshape them. You can use contact lenses from the 3rd day after the operation. What is the process after returning from Istanbul? Rhinoplasty requires patience, and it may take a few months to see optimal results. After returning from Istanbul, we will typically contact you after 6 to 12 months. Our surgical nurses and surgeon perform post-operative follow-up evaluations of patients coming from abroad. We ask you to send us 180-degree videos at 2 weeks and 2, 4, 6, and 8 months after the operation. The video should be recorded at a distance of 1 meter in sufficient natural light. Avoid recording the videos from a very close distance because mobile phone videos are influenced by the fisheye effect. The videos will only be used for follow-up evaluation by Professor Dr. Seckin Ulusoy. Based on the evaluation, our surgical nurses will provide you with suggestions if needed. At this stage, we will ask follow-up questions regarding your massage and healing process. We will provide suggestions to prevent revision surgery. Please remember that appropriate massage may not only reduce swelling, but also improve the operative results.